Okay, hi everyone. I'm Shakira from Institute for Public Health. So my title is Comorbidities and Clinical Features Related to Severe Outcome Among COVID-19 Cases in Selangor, Malaysia. So this paper was published in Western Pacific Surveillance and Response Journal WPSAR on February 2021. So as introduction, COVID-19 or coronavirus disease is an infectious disease caused by SARS-CoV-2 virus. It was first detected in Wuhan, China and spread all over the world. And on March 2020, WHO was declared this COVID-19 as pandemic. At the time, Malaysia also not been spared from this pandemic with total infected people is around 5,000 cases and 82 deaths. Underlying comorbidities such as cardiovascular diseases, especially among elderly, has been shown to be predictor of severe outcome and poor prognosis in COVID-19 patients. So early identification of risk factor of severe COVID-19 disease require intensive care would be helpful for managing hospital admission. So this study was conducted to compare the comorbidities, clinical feature and other predictor factor that required for ICU admission and mechanical ventilator support. So this study used data from state of Selangor during COVID-19 outbreak. We recruit all confirmed cases and that was reported under state of Selangor up to 13th of April 2020. So the confirmed case was based on RT-PCR testing. So for measurement, our outcome variable is status of ICU admission that required intubation, and for predictor variable is socio-demographic characteristic, comorbidities, and also main symptom of COVID-19. So for statistical analysis, we use multiple logistic regression to identify the factor associated with intubation among positive cases. So as a result, a total 1,287 positive cases was included in this analysis. This is a distribution of patient positive case. The proportion was higher among male, those who Malay ethnicity, and age group 18 to 29 years. The median of age is around 39 years old. So for comorbidities, among positive cases, 50.5% have hypertension, 11% have diabetic, and followed by heart disease and chronic respiratory disease. For symptom, about 43% have presented with fever, followed by cough and lethargy. Among those who was hospital admission, 2.2% was intubated and need for ventilator support. So among intubated patient, 72% was male, and more than half is aged 60 years and above. And those who have hypertension, about 70%, followed by diabetes and heart disease. So our final model using multiple logistic regression shows that gender, age, hypertension, fever, dyspnea, and lethargy was associate factor for intubation. So this is odd ratio using adjusted multiple logistic model. The proportion of COVID-19 required for intubation in this study was 2.2%. It was similar with study from China, but lower as compared to United States. Hypertension and diabetic were the most common comorbidities among COVID-19 cases. It was consistent with finding from China. Same with symptom, consistent with other study. The most common presented symptom is fever, followed by cough, dyspnea, and lethargy. For factor associated, older age with underlying comorbidity has been predictor of poor outcome in viral infection, similar to study reported from China and Italy. For hypertension, the odds of being intubated was higher among those who have hypertension. It was consistent with systematic review study, shows that the pool odd hypertension in severe patient who have hypertension was 2.36 times compared to non-severe patient. As a conclusion, COVID-19 patient aged 60 years and above who had hypertension and presented with fever, dyspnea, and lethargy were more likely to intubated and ventilated. So this patient need to be screened for COVID-19 when presented in any healthcare facility and should be monitored closely by clinician. In addition, public health intervention should aim to provide additional protection to older population and patients with comorbidities because they are more vulnerable to severe disease progression. So that's all for me. Thank you.